And good afternoon, Tuesday, September 30, 2025. I'm Dr. Deuk, and we are streaming live spine surgery from Deuk Spine Institute. Our patient comes from Michigan. He's had a fusion done 10 years ago. You can see it there on the x-ray. Jordan, point out the screws, rods, cage. Now, I didn't do his fusion, but take a look at this screw on the other side. You guys see that at S1? Now look at the halo around the screw. You see that black line that Jordan is beautifully showing you? That means the screw is wobbling loose in the bone. That's one of the complications of fusion. Margie, you see that, Margie? That halo around the screw in the sacrum? And that's on the patient's right side. But we're not here to deal with his fusion. His fusion is done. What we're here to deal with is the pain that he has now from the fusion in his sacroiliac joints and his piriformis muscle. He has a piriformis muscle tear. He has sacroiliac joint pain, all as a result of this fusion. So we're going to be fixing his left SI joint and left piriformis this afternoon. We're going to start with the SI joint. While I get ready to treat his SI joint with the Deuk plasma rhizotomy, Jordan, can you show Henry, can you show our audience what causes sacroiliac joint pain? Sean?
Sacroiliac joint injury is a common cause of chronic back pain. The inflamed sacroiliac capsule tear generates pain signals. The best treatment for sacroiliac joint pain is the Deuk plasma rhizotomy. Sacroiliac joint pain nerves are destroyed. The advantages with the Deuk plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-BACK, 349-6922.
All right, welcome back. As you can see from our video, the SI joint can be riddled with arthritis pain coming from inflammation, like this patient's. The only way to get rid of that pain is to get in there and destroy the 5 pain nerves to the joint. Each SI joint has 5 pain nerves, and those pain nerves just keep firing and firing all day long when you have a problem with your SI joint. So I need to see this. Thank you. You can see the entire surgery was done through a 4mm incision. You guys see that right there? 4 millimeters.
Yes, we do.
Okay. And our patient has lots of nice tattoos. He's very proud of. His Doberman tattoo is his most proud tattoo. Any questions about the SI joint and the Deuk plasma rhizotomy?
No current questions.
All right, let's get to the piriformis. So let's go ahead and bring everybody. You know what? Let's just keep going while we're here,
Copy.
rather than doing another stream. This patient's had a hip replacement. You all see that?
Yes, we do.
That is not a mushroom growing in his leg. That is a hip replacement, Sean. And that's an implant on the hip. Basically, Sean, the patient, you got him? Yes. The patient's hip was replaced, go ahead. But when they do a hip replacement, they oftentimes will accidentally tear the piriformis muscle because they got to wiggle your hip around, and that will tear the piriformis muscle. So I think he woke up and he had pain in his buttock after the surgery. Long story short, no one's been able to tell him why he has pain in his buttock until now. And he came to Deuk Spine and we told him, you've got a piriformis syndrome, my friend. And he now is here to get it fixed. You can see the piriformis muscle right there in that picture. You guys see it, Jordan? Show them. Yeah,
Yes, we do.
That is the piriformis muscle. Shot. All right. Need to be a little lower. There we go. Almost there. I've got to get to the spot before I can start doing his surgery. Just about there. Any questions?
No current questions.
All right, then in that case, let's show the audience why do piriformis muscle injuries happen and how can we fix them minimally invasive in a way that works to get rid of the pain but doesn't interfere with quality of life. Man.
A piriformis muscle tear can cause lower back pain and sciatica. A piriformis muscle injury causes a tear, in which piriformis muscle inflammation causes back pain. And also, piriformis muscle inflammation may cause sciatic pain. The best treatment for piriformis muscle syndrome is the Deuk piriformis release. From there, the piriformis pain is permanently eliminated. The advantages with the Deuk piriformis release is that it's an outpatient procedure, which would take up to about 30 minutes. Minimal bleeding and pain after the procedure with an immediate recovery and return to work the next day, as well as a 99% success rate with permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-BACK 349-6922.
Welcome back. So this patient has piriformis syndrome, Sean, and we are releasing his piriformis muscle off the greater trochanter because that is the only treatment that will get rid of this horrific pain that he's suffering from. It works. Our success rate is basically 100%. As long as you have piriformis muscle pain, this treatment works. Now, that was the deepest piriformis muscle I've ever treated. And people don't understand that. You see, your buttock has a bunch of muscles. You have the gluteus maximus, gluteus minimus, gluteus medius, and then below that you got these obturator muscles, piriformis muscle, and I mean they are way in there, deep in there. So the pain is like deep, right at the top of the butt cheek, kind of between the butt crack and the side of the hip, right in the middle there at the top of the butt cheek. That's the piriformis muscle pain. We've just done the release. There was a lot of scar tissue from tons of inflammation going on for years. Hopefully that does the trick for this gentleman, and he is going to be happy with the results. We'll see you tomorrow. All right, thanks for joining us. Any questions?
No current questions.
Thank you. And good morning, I'm Dr. Deuk, and I'm here with a patient from Kentucky who came here for a couple of issues, but one of them was piriformis syndrome. She had a torn muscle in her buttock. It was balled up tight with scar tissue, spasming all the time, causing buttock pain and compressing her sciatic nerve. So she had sciatic pain down her leg, and you had the Deuk piriformis release yesterday. How do you feel?
Today, I feel really good. I no longer have pain going down my leg into my foot and heel. I just have some muscle soreness now, and we're at the surgical site.
And how long have you had that piriformis syndrome?
At least 8 years is when I first noticed it.
Yeah, 8 years. So, and the muscle was very scarred, and when I had to release it, I could feel how thick it was and how tight it was. So it went very well for you. What kind of problems did the piriformis syndrome cause for you in your life?
It got to the point where I would not leave the house because I could only go to work and come back because it hurt so bad to work and to do anything after work. I've had 2 surgeries on my hip, and the second one was a total hip replacement, and the pain was still there.
So you had hip surgery that didn't even fix the problem, and then you
Right.
came to Deuk Spine, you woke up.
And it's much better. I can walk without pain in my foot and leg. Like I said, just muscle soreness at the surgical site now.
How did you hear about Deuk Spine Institute?
Online, I was Googling my symptoms, and your website kept coming up, and I ignored it for a while because I really just wanted to stay in my area if I needed any surgery done. And I finally decided, well, there's no one in my area who can help me. And so I clicked on your name, and I thought, wow. Started watching your videos and saw that you had a free MRI consult.
Mm-hmm.
So I did that. Now here I am getting it taken care of.
Well, you hit the nail on the head. There's no one in your area that could help you. And that's true for millions of people suffering with back pain. Their doctors cannot fix them. So that's why we are so active online, trying to make people aware that there is help for them. But they have to travel to Florida. Well, right?
Yeah.
Beaches.
It's an easy jump down here. So
Yeah, and you
Yeah.
could see in the surgery, we went in with a 4mm incision. And this is a pioneering new technology where I went in and released the piriformis muscle with almost no bleeding, no hospitalization. It was outpatient. So you actually went to your hotel with your daughter right afterwards, and here you are today.
here I am.
So how is life looking for you now without this piriformis problem?
So much better. I am looking forward to getting back to my normal level of activities. One of my goals is to get out and hike, again, 5 or 6 miles a day. And like I was doing, I'm looking forward to that.
Awesome.
Yep.
Anything else you want to say to your family and friends and fans out there?
I would say that, do your research, but you're going to end up back with Dr. Deuk. There's no one like him that I found. I did a ton of research throughout the country at first, and then I focused on my regional area, and there was, you're going to come back to Dr. Deuk without any hesitation.
And we welcome everybody because we want everyone out of pain. That's our goal.
Yep.
That's our mission at Deuk Spine. Get rid of pain permanently so people can have a normal life and enjoy life.
Right.
Well, congratulations.
Thank you.
You took the leap of faith. You came here and got it done.
Yes, absolutely. Thank you so much.
You're welcome.